Okay, so 5 things that you probably did not know about Lamotrigine. Oops, about Lamotrigine. So, question number 1. What stage of bipolar disorder is Lamotrigine FDA approved for? Let me give you options. Bipolar mania, bipolar maintenance, or bipolar depression. And the answer is bipolar maintenance, which basically means that Lamotrigine has been shown to increase the time between episodes of depression and mania, and it has been shown to be more effective for prolonging the time between episodes of depression than it is between the episodes of mania. This is why they use a fancy name, the fancy phrase, that Lamotrigine stabilizes from below, which means that it's better for prolonging the time between episodes of depression. And let's go to question number 2. So we all know that a serious side effect of Lamotrigine can be rash. And because of that, we increase the dose of Lamotrigine very slowly. Now, here is the question. How many days of treatment can the patient miss before you have to go back and start from the initial dose? How many days can they miss before you have to start from the initial dose? And the answer is 4 days. So if your patient misses more than 4 days, you have to go back and start from the initial dose, which is 25 milligram. And speaking of rash, let's talk about question number 3. And I'm going to make it a 4-step question because I feel like it's very clinically relevant. So I'm going to tell you the 4 steps. The first step is that let's say you started someone on Lamotrigine. What is the likelihood of developing any rash, even a benign rash? What is the likelihood of developing a benign rash in patients that you start on Lamotrigine? The second part of the question is that, okay, what is the likelihood of developing a serious rash in patients that you start on Lamotrigine? The third part of the question is, how do you tell them apart? And the last part of the question is that what do you do in each circumstance? So you started someone on Lamotrigine, they developed a benign rash. What do you do? You started someone on Lamotrigine, they developed a serious rash. What do you do? So think about that for a second. And here are the answers. The likelihood of developing a benign rash is 8%. So 8% of your patients whom you start on Lamotrigine, within the next 4 months of treatment, they will develop a benign maculopapular rash. And then the likelihood of developing a serious rash is 0.08%. So if you look at these two numbers, it seems like out of every 100 patients, for every 100 patients who develop a benign rash, 1 patient will develop a serious rash. This is 100 times this one, right? Yeah. So the question is how to tell them apart. Well, the first thing is that your patients will probably not be able to tell them apart. So you tell them that if you noticed any rash, you just hold your next dose and you call me. Or you go to an emergency room. Now, let's say your patient called you or they came to the office and said, hey, I have this rash. How do you tell them apart? In an ideal world, you probably, in an ideal world, a dermatologist should see the rash and help you in figuring out whether it's a benign or a serious rash. However, in the real world, a lot of times we don't have that access. So let's talk about some of the signs of a serious rash. I could find 5 signs of a serious rash. The first one is that it's a confluent rash, meaning that as opposed to a benign maculopapular rash that, you see the lesions, they seem to be separate. A confluent rash, you feel like the lesions are coming together and joining together. The next one is that a serious rash can be purpuric, meaning that when you put pressure on it, it's not going to blanch. And then that brings us to the third sign. When you put pressure on it to see whether it blanches or not, if it's a serious rash, it can be tender and painful for the patient. The fourth sign is that a serious rash is usually, you can see it on upper trunk, neck, and mucosal membrane. So like your mouth, eye, you may even see a pharyngitis. And then the last sign is that you can see signs of systemic inflammation. So fever, lymphadenopathy, all of those are signs that this might be a serious rash. So let's say you had a patient, they came to the clinic, they showed you a rash, seems like a very limited maculopapular rash. You don't feel like it's a serious rash. What to do? So for a benign rash, you obviously have to, you decrease the dose. First, you treat the rash with antihistamines and corticosteroids, and you are going to be very careful about going back to the same dose. You are going to have very detailed discussions with the patient and very carefully evaluate risks and benefits if you want to go back in the same dose again. For a serious rash, obviously, the patient should not be challenged with Lamotrigine again in the future because they developed a life-threatening rash and they obviously need to go to the emergency room for a better evaluation. Now, let's go to question number 4. Name a psychiatric medication that if prescribed together with Lamotrigine, you need to cut the dose of Lamotrigine in half. And the answer is valproic acid. The one thing which was interesting for me as I was reading about it is that when you start someone on Lamotrigine and valproic acid, which obviously we try to avoid unless absolutely necessary, but if you do that, then you will cut the dose of Lamotrigine in half. But interestingly, Lamotrigine has quite the opposite effect on valproic acid, meaning that you need to increase the dose of valproic acid by 25% because Lamotrigine actually increases the metabolism of valproic acid. So that was quite interesting for me, that you need to decrease the dose of Lamotrigine but slightly increase the dose of valproic acid. And that brings us to question number 5. Name 3 medications that if prescribed together with Lamotrigine, you need to double the dose of Lamotrigine. This is the opposite of the previous scenario. Here you need to double the dose of Lamotrigine. 3 medications. And the answer is carbamazepine, phenobarbital, and phenytoin. One thing which is not in the questions but was interesting to me, it was not very clearly on my radar, was that there's also another important drug-drug interaction between Lamotrigine and another psychiatric medication. Can you guess what that other medication is? Sertraline, which is prescribed, very common. Sertraline also increases the serum levels of Lamotrigine. It's not as bad as valproic acid. So you don't need to necessarily cut the dose in half, but that's something that was interesting to me, that there's also some interaction and I need to be more mindful if I have a patient who is taking Lamotrigine and sertraline at the same time. I hope this was helpful. Stay safe. Bye.